Perfect. Okay. So, all right. So I'm going to welcome my friend here, Dr. Lisa Palmer. And so Lisa, I wanted her to share some of her success stories, some of what she has done with her practice. Lisa's been in practice, is it 16 years, Lisa?
20 years.
20 years. So she started as she was 12 at the time.
That's right.
Yeah, yeah. So, so she's built up her practice, which does quite a bit of nutrition. Actually, nutrition. They're working with practices all over all over. Sorry, with patients all over the world. And they do chiropractic. And she's built that up, and she's got a number of providers in there that are doing great at her practice. She's got another business, which is Quantum Nutrition. So she came up with Quantum Nutrition, and that's helping her to treat patients all over the world. Then she's got Quantum for Pets. Um, we were down in Orlando at her event last month, which had hundreds of providers at it, and that was Quantum Leap. And so she's got that business running there as well. Her husband, Jason, runs Brave TV, which is another business, which is educating on health, and they've got a whole lot going on with that. And I believe there's a couple more that I've missed out. Is that you, do you want to fill us in on what else you have going on there, Lisa?
Yes. Well, thank you. Thank you, Quentin. I can't believe it's our 20th year anniversary being in private chiropractic practice. And yes, lots of nutrition and a little teeny bit of massage. But yeah, the ability to run other businesses came very much from the programs that we implemented from the Business Academy. And so we have the Quantum Nutrition Academy, which is online classes to implement nutrition into your office. And then with that is the Quantum Leap event, which you were talking about. And then we have some real estate companies. And then my husband has his show, Brave TV, which I was kind of laughing because he's on that right now.
Oh, wow.
While we're live here with, together, he's on his show, Brave TV, speaking about health freedom and all the changes that happened when President Trump took office yesterday.
Awesome. Awesome. Okay, cool. Okay, so I guess I really wanted to start off, and I think that what people are usually pretty interested in as far as kind of how we go through this is um, what was it like when you started off in practice, and and then what were some of the challenges that you were initially having at building up your practice? Obviously, you've got a whole different situation now, but when you were first started that off, tell us a little bit about what that looked like.
Yeah, so reminiscing, maybe you guys can relate. In 2005, I started my practice. I never was an associate, but I've done preceptorships and work with other chiropractors throughout undergrad and so on. Moved to Orlando. I'm from Miami, so moved to an area that I'm not from and only knew two people in Orlando. Rented space from another doc and worked like a dog. So I was so poor that I was still running around in my four-cylinder Pontiac Sunfire with peeling paint and rusty doors and worked at Cracker Barrel, which is a country restaurant, as a cashier. I would see patients and change into doctor clothes and be treated like I was intelligent. But when I worked at Cracker Barrel, people thought I was stupid. And then I would end my day working at one of the local gyms. I have a degree in exercise science from the University of Florida. I was a certified athletic trainer. So if you watched any of the NFL games this weekend or the national championship game last night, when you see those people run onto the field, that's what I used to do for sports injuries. And so I would end my day working in the gym, but not doing strength and conditioning or sports medicine or anything like that. I was the person that would take your membership card and run your membership card and say good morning or good afternoon and answer the phone. So basically my first year in practice super sucked. I was too stubborn to get a coach because I thought my earlier experience working with some chiros that I already knew everything and I just had to work harder and kill myself as far as working at a restaurant, seeing patients, and working at a gym in order to be successful in it super, super sucked. My accountant at the end of that first year congratulated me and said that, congratulations, Lisa, you made as much money. You made less money than if you were to be a waitress at a restaurant. And the punch in the stomach was my accountant at the time was my father. Ouch.
Wow. Okay. But hey, at least he didn't dissuade you from being in practice at that time. He knew your goal and where you were going.
He wanted me to be an associate. There was
Oh,
an
he did.
associate in Miami where we're from who wanted to hire me, and the associate or excuse me, there was a doctor in Miami who wanted to hire me as an associate, and he wanted to pay me so well that I could only afford to live with my parents and be broke. And so my dad wanted me to do that because I guess he wanted me to hang out and still be in Miami and be close to him. But yeah, that didn't sound like a good option either.
Okay. Okay, cool. So then where did things change for you as far as, that struggle to then, kind of coming up on the up and up there?
Yeah, from being broke and working like a dog, to where the change really happened when I asked for help. When I realized that I don't have all the answers and what I'm doing isn't working and freaking sucks, is when I started implementing systems that gave my business organization. So I actually knew how much money I was making, gave me systems for marketing, gave me systems for hiring staff, gave me systems for handling my finance. And a lot of those systems came from when I decided to be a client of the Business Academy.
Awesome. And and so when you did that, what were the very first systems
I didn't have any kind of
that kind of
system for,
changed things for you?
yeah, I didn't have any, I didn't have any systems for the front desk. And
Okay.
so when I was renting space, my space included sharing the receptionist. But the guy I rented space from never told the receptionist that she was supposed to answer the phone for me. And so I remember asking her one day, like, hey, how come you never answer my phone? And she looked at me like, why should I? And I was like, well, because my rent pays you to do that too. And she's like, well, the owner never told me that. I was like, oh my gosh. So when I finally
Wow.
had my own front desk person, it was systems that the Business Academy taught me on how to teach her, and then having her watch some of the videos that you guys have on how do you have a front desk and how do they answer the phone and convert that phone call to a new patient. And one of the biggest gaps I had is I didn't have a system for signing up new patients. I wasn't comfortable asking for money. I wanted to give away free consults because I felt weird asking for money, even though, chiropractic school is no joke to get through. And as a trained doctor of chiropractic, my service and my knowledge base is absolutely worth money. But I was like, we didn't collect money in school. So how much should I charge for an exam? I don't know. And then once I do the exam and I have a treatment plan, like how do I present that to the patient? So I super sucked at that and was very uncomfortable with that. And one of the first courses I took at the Business Academy was how to deliver a report of findings. And one of the ways that I know how long I've been in the Business Academy as a client was, my daughter was born and I took that class 3 months later. And so I was still breastfeeding, I was sleep deprived, and you guys were super, super kind and understanding what a tired mom who's trying to build a practice goes through. And it was that course and implementing that report of findings course into my practice where I didn't have to try to convince the patient to come back next week and collect money every single time. It was that course where I learned how to deliver a report of findings for chiropractic and do it confidently and handle any objections, handle any reasons why they may not start, and then actually get paid for the service you deliver.
That's great. And that's where a probably the majority of clients that sign on with the Business Academy really see a huge change at the beginning is with a report of findings and with putting that in place there. And so when we train on report of findings, a lot of times what we find out, first of all, doctors are giving a number of options. Well, you can sign up for all the care, or you can do, or here you could just do less than that, or you could just pay as you go. Um, and then they're not asking for the, however much they should be being paid for what that looks like. Um, Things like that. What was that like for you prior to, prior to doing the report of findings? What was, what were you offering? What was going on with your patients, and how many, you know, were your patients getting well with the amount of treatment you were doing? What did that look like? Findings.
Yeah, it was super frustrating because I didn't have a system. And so
How many?
they, patient would show up for a couple adjustments and then feel better and I'd never see them again. Maybe they came in for a couple weeks and I had to resell them, an adjustment every time, and they had to pull their credit card out every single time to pay for the adjustment. And so it was absolutely frustrating when I put the report of findings in that the Business Academy taught me. Now I actually had time to help the patient, so my patient results were better. I actually, have had patients for 20 years that are still my patients, either chiropractic, nutrition, massage, or all three, which is awesome. So I don't have to keep looking for new patients, and
Sure.
I've had the ability to have multiple associates. And so it's like night and day, going from being broke, not knowing, if you can pay your rent and pay off your credit cards. And I had credit card debt, and I live with my parents. They moved up to Orlando in the house that they bought as a vacation property that I convinced them to buy as a vacation property, but really I wanted to live in it without paying rent and watch it for them. But I was broke. So then I was able to buy my first house cash. I was able to move out of my parents' vacation house. It changed so many things in the practice.
Awesome. Now, I get asked this question a lot, and a lot of times doctors ask. So, as far as nutrition, can you give me an example of what a package and what you would be like in your report of findings? Obviously, you're finding out what's going on with the person, but then what would a package look like? What would you be getting that patient to commit to in order to better their health? And if you can share some kind of dollar figures of what that might look like in your practice, how does that go?
Yeah, sure. So the specific nutrition that we do is based on muscle testing. It's based on applied kinesiology, and it's called quantum nutrition testing. And I founded that during the pandemic. The short story is my father slipped, hit his head, and then went to hospital jail because that's when hospitals had no visitation. And I was able to figure out a system of helping him at a distance. And so now I teach that system in the Quantum Nutrition Academy. And one of the things that I teach is putting your nutrition patients onto a membership. And so it's a 3-month membership. Those memberships go anywhere from $2,000 cash to $4,000 cash, depending on the system that you want to utilize. And the really fun thing is I feel like a detective in that I can figure out why. I can figure out the cause to why that baby has eczema and they're scratching off their skin, or why that female patient has hormonal PMS syndrome symptoms and gets super bloated and grumpy and irritable, or figure out why that female a little bit older has menopausal symptoms and she's like sweating through her clothes. And so when you combine nutrition with chiropractic, it's a beautiful marriage, and the chiropractic helps the nutrition and the nutrition helps the chiropractic. And so, yeah, so a couple new patients, just putting the quantum nutrition testing technique into your practice, you can move up to a $250,000 practice. Four new patients a week or so, you're looking at a $500,000 practice. And that's not counting your chiropractic visits or your follow-up visits in nutrition, or any other existing services that you're having. So it's just a beautiful blend. But TBA, you guys are the ones that taught me how to do that chiropractic report of findings. And then I made one specifically for quantum nutrition testing to get people to agree to care, right? Like they give their medical doctor 7 years of allergy shots to fix their allergies, which never occurs. And then with chiropractic, I think we have such big hearts that we're like, okay, well, one adjustment and your headaches should be better. Like, that's not fair. You gave the medical doctor 7 years with your allergy shots and you still have allergies. And and our patients are expecting miracles. Well, yes, we have chiropractic miracles, but when you implement a report of findings like the Business Academy teaches, you have more time to really help that patient. And then you add nutrition in, and then you just see the coolest things happen.
Great. So then are your packages inclusive, like you're doing chiropractic and nutrition packages all together and the patient's signing up for all of that, or is that two separate?
So the pricing I gave you is just for nutrition. So
Great.
just for nutrition is between 2K and 4K. That does not include, that's for 3 months, and that does not include supplementation.
Yeah.
Each nutrition program is personalized for that person. So somebody might require more supplements, someone might require less supplements. And then chiropractic, we sell packages of 12 visits. And
Okay.
so they'll come in, they can come in for their chiropractic, and then they can come in for their nutrition, or we can also do their nutrition telehealth.
Great. And and now I know you do a lot of marketing. Obviously, well, you know, you've got the TV, you know, the Brave TV and all of the streaming, you know, there's a lot of marketing that goes with that. But you've also got and you've done some amazing events, marketing wise, and done out and did talks and different things like that. And can you tell a little bit about kind of what that looks like with your practice of being able to drive people in? Because you know you don't have any lack of new patients coming in your office.
Yeah, so we see about 400 patient visits a week, and that's with multiple associates. And I think where a lot of chiropractors and people in natural health care fall short is the amount of marketing that it requires for new patients to know who you are. And so my team, we do social media marketing, we do webinars, we do in-office seminars, we do patient parties. We speak at other events. We do lunch and learns. I mean, there's so many things that, so many avenues. It's not just this one thing, like just don't pay Google for SEO. There's so many different things that need to be applied in order for that new patient to find you.
And and what are some of your best events that you've done? Like just kind of an idea of what that looks like. Because you know, I mean, I see a lot of people that were there were a lot more events being done prior to the pandemic, and it's kind of coming back, but it's an opportunity that many chiropractors are not doing, or nutrition practices are not doing, is getting out and doing those events because, you know, the pandemic happened and the only thing you could do was social media. Yet, you know, that's all over, and you know, we can get out. What are some of the best ones to be driving people in that way?
Yeah, I mean, we had amazing, I mean, in Florida, we had amazing events during the pandemic, best
Sure.
attendance, because I'm here in Orlando and a lot of other things were closed. So we were like the thing. One of my favorite events that we run every year is a garden party. And what we do is we get a bounce house. So if you're going to have an event at your office, or if you don't have a big office, you could also have it at a gym or a community center. If you're in networking groups, you can have some of the people in the networking groups be vendors at this event. And so everybody has a piece to contribute. And so the garden party is an Alice in Wonderland theme. So we hire a bounce house because you got to keep the kids busy, because if the kids are bored or they're hungry, they're out, right? So we get a bounce house. I prefer the ones with the slide, because if you just get the bouncing one, then you might have so many kids that there's not enough space for them. So the slide keeps you having enough room for kids to kind of cycle through the bounce house. So you have a bounce house. You can hire characters. So we hire an Alice in Wonderland and a Mad Hatter, and they walk around the party and they talk to the guests, and they're goofy and silly, and it just adds a whole other point. People take pictures and they post it on social media, which helps to promote your practice. We can do free chiropractic scans. Since it's your own event, you can give yourself the best booths, right? And so we have a chiropractic booth, we have a quantum nutrition testing booth, we have a chair massage booth, we have, there's a local company that does fresh cold pressed juice. So we have a juice booth. We have a lady who does Color Street nails, which are those sticker type of nails. We have that. And so basically we're pulling vendors from our patient base, or we're pulling vendors from people that we know. We charge them a $25 a vendor fee to participate and then ask them to help promote the event. And so now the juice person is bringing us juice as a snack. We've had a baker who makes healthy treats, and they are in charge of the food. Some of the vendor fees help to buy platters from the local grocery store, like a veggie platter or a meat and cheese platter, and you can serve that because you don't want people to get hungry and you don't want the kids to be bored, right? Because then they're leaving. And then you can have a special chiropractic offer. So everybody attending your garden party gets a $99 consult or whatever price you want, but they have to buy it that day, and they have to sign up that day. So your front desk person is actually scheduling your new patients at the event and collecting at the event. Because it's at your location, it's free because you have other vendors. It helps to spread the cost, but it also makes it interesting. And it's just super fun. So I would say out of all the events, the garden party, which we're about to launch again in this March, is my favorite. But the key to that is it takes promotion. You can't just have an event and expect people to show up. You have to invite your patients and send emails and get an RSVP list and go to networking meetings or your chamber. And so where events like that fail is that people make it look cool and have some food, but you have to really push on the RSVP list.
Great. That's awesome. Yeah. And then at the Business Academy, we train marketers, and, we've put together at least 30 forms of marketing that, can work and we've got marketers that are working, and they're full-time out there setting up the events, doing these different things, putting them on, and you can do lunch and learns, and you can do, other talks and so forth, and they can be the one that's running all these things. And it really becomes a great way to drive in new patients with doing that. So as you grew the practice, and as then that started to kind of come about, I'm sure the patients wanted to come and see you, right? And so you've got you're in there, you've got other people in there. How did you get yourself from being the one who's, everybody's coming to, your practice is called Palmer Natural Health, and, you're a badass at it. And so the patients come in and they want to see you. How did you transition from doing that to moving into the role where now you are, able to have other people doing things?
Yeah, great question. So it took a lot of coaching from you guys, because when you are a chiropractor, you kind of identify yourself. I'm Dr. Palmer, right? That's what I do. So the thought of having other people do what I do was kind of like a loss of identity, And so I started training associates working aside of me. And then a couple things kind of pushed me out of patient care, not because I don't love taking care of patients. I love taking care of patients, but I realized that the potential to help more people is from myself teaching in the Quantum Nutrition Academy and running other events like Quantum Leap, and doing more things that I can't do if I'm doing chiropractic and doing nutrition myself. And so training associates in nutrition is easy because I'm an instructor in nutrition, and now I have an academy to teach other people how to do that, how to do our nutrition work. And so having an assistant who wanted to train in nutrition is one of the best ways to train a nutrition associate. And in many states, they can function as a health coach, so they don't necessarily need to be a chiropractor. And so I had that assistant work alongside of me. She got to know all the patients. She got to know all their cases. She got to know that Mrs. Jones prefers to sit, and Mr. Smith prefers to lay down, and Bob likes this. And the patients got to know her super, super well, to the point where they were like, oh yeah, when we went to transition from me coming out of patient care, they all transitioned to my associate really, really easily because they already knew her, they trusted her. And so it worked super, super well. And so, yeah, and now as the owner, I have the freedom and the time to work on these other companies, which is awesome. But it was a lot of coaching from you guys, because I was like, okay, well, I'm Dr. Palmer, and if I don't function as a doctor, like, what do I do? And I come to find out there's a lot of things, there's a lot of things to do. And it's really rewarding working with nutrition practitioners, working with chiros that want to learn nutrition, and teaching them, and then they can bring that to their practice and see all the wins. Nutrition's way easier to market than chiropractic. People understand you should eat healthy. They just need help with how do you do that, and then they have conditions that the medical system is not giving them natural solutions to. They're just covering up with medication. And so, yeah, that's how you transition. It was the systems that TBA, the Business Academy, taught me that enabled me to transition properly.
And so how long now have you been out of full-time patient care?
2 years.
Okay, perfect. Do you still treat patients yourself in the office?
Not really. I was trying to think of the last time I actually saw a patient. I don't think my daughter counts, like,
Yeah.
some adjustments for her. I do have a VIP patient, so every now and then, I like to keep my hands. I don't know. I still enjoy being a chiropractor and I still enjoy doing nutrition. And so I have a VIP client that I just scheduled actually more for fun, to
Yeah.
doing it for fun, but not because I have to. And so I'll do the consultation, I'll do the quantum nutrition testing. I might even do a chiropractic exam just for fun. And then I'm going to transfer that case over to my associates.
Great. So, so then, you touched on something there, which is, if I'm not treating, what do I do all day? What do you do all day if you're not treating? I mean, this is what, I, I know how I can answer that, but I get asked that question, because, we're working with people who are clinicians. They went to school, they learned to be a doctor, they learned to be a clinician, and that's what they know, and that's what they're doing. And so now, if they're not utilizing what they went to school for, uh, you know, do you play Candy Crush all day? Do you like what does your day look like when you're not doing that?
Yeah, so that was one of the things that I had trouble with and asked some of the members of the Business Academy. I'm like, if you're not seeing patients all day and feeling chained to your chiropractic table, like, what are you doing? And they're like, oh my gosh, I'm doing this, this, and this. And it wasn't really real. I would say I didn't answer part of your question. Why I finally made the move is my father had a medical error, we'll say it like that, and ended up in the hospital for a month.
Oh,
And so what completely pushed me out of patient care was I wanted to be able to, and I think a lot of you guys on here would agree, if you have a family member in the hospital, you want someone to be able to advocate for them. So I wanted to be able to talk to the cardiologist. He had a major heart attack. I want to be able to talk to the surgeons. I want to be able to be there for my mother and for my father. And so having associates trained and having the systems that I learned from the Business Academy, I was able to be at the hospital every single day for a month. And still have my patients being taken care of and still have my practice do well and still have everything happen. So that was what, like, ripping the Band-Aid off, that was what really transitioned me. Not a fun way to do it, by the way, if you're looking to do that. And then once, of course, he got better, then I was like, oh my gosh, like now I have time to do some of my other dreams and some of my other goals, which I didn't have time to do when I was chained to my chiropractic table, right? When you're sitting there being a white collar mechanic and you're working on human bodies all day long, I couldn't go anywhere. I couldn't go on vacation. I couldn't work on side projects. All I did was adjust. And believe me, I love chiropractic. Chiropractic is the reason why I can walk. So it's not me not loving chiropractic. It was just like I felt like a slave to my practice, and I was.
yeah, yeah.
So to answer
Oh,
your question, so what do I do now? Now, one of my purposes is to teach quantum nutrition testing. And so this morning I was on a call with 10 docs and helping them with quantum nutrition testing and incorporating that into their practices. I now have the ability to, like Quentin was saying earlier, run big conferences, and you guys are all invited to Quantum Leap into Health Conference, October 3rd, 4th, and 5th, where we put all awesome holistic practitioners together and really work to how do we change healthcare. I think with Robert F. Kennedy being a candidate in President Trump's cabinet as far as getting rid of the CDC and getting rid of the NIH and getting rid of the FDA, this is the time for natural health care to shine. President Trump said yesterday that he wants to work against the chronic disease epidemic. And I'm like, great, like this is the time for chiropractic.
yeah,
If anything, they're gonna be pushing people our way. So having the time to do side, I don't even want to say side, but like living your purpose and fulfilling your mission was given to me when I implemented the systems that TBA teaches.
That's great. That's great. Okay, good. And then so, obviously you've got plans, and I think last year you spent probably half the year out of your practice. Is that right?
Yeah. Yeah. Well, I spent the whole year out of my practice.
Okay. Okay.
And by out of my practice doesn't mean that I don't check in with them. One of the things that the Business Academy teaches is how to manage. Like, like before I was like, okay, well, how do I know if my front desk is doing her job? Or how do I know if my massage therapist is doing a good job? Or my associates are doing a good job? Or the front desk people are doing a good job? And one of the things that was crucial in that is implementing statistics. A
Yeah.
statistic is a numerical measurement of something. And
Yeah.
so not being physically in my location, utilizing, analyzing statistics, which some of you guys are like, that sounds boring, but actually it gives you control over your practice so you're not worried and stressed. That was one of the major factors in being able to help them, right? So I still was on the phone with key players in my practice, and investing in those key players and training so they could do that.
Right. And then obviously having every single person having their own statistic for their own
Yep,
job, right?
absolutely.
And then when you have those statistics, then um, it's funny, a lot of people tell me, oh yeah, I have statistics, but they don't have any graphs. And and if you don't have a graph, and I'm talking about a line graph, then you really can't look at those things. To just look at a number to another number, yeah, it's better than nothing. But when you have that graph and you can see a trend, that really does something for you. And then we teach formulas for how to improve a statistic or how to maintain an improvement in a statistic as well. Um,
Yeah.
what does that look like with you?
Yeah, so being out of the office, I was actually out of Orlando. I wasn't even in Orlando, and a couple hours away at certain points. And being able to look at the statistics and then apply the correct formula, it's almost like a magic formula. So if the stat is up, how do you keep that stat up? If the stat is down, why is the stat down and how do you bring it back up? And so it's control as an owner because you guys are not just docs, you guys are also owners and entrepreneurs. So
Yeah.
how do you have control over your finance? How do you have control over, okay, look at your patient visits for the week and are you up or are you down? And if you're down, how can you make that go up? If your new patients are down, how do you make that go up? What do you do? And so TBA teaches you how to look at those things and not getting confusion over math because it's very simple. How do you apply specific formulas? How do you apply specific steps to improve your statistics? And then teach your staff, they'll teach your staff how to do that too. So you can say, okay, well, what formula are you going to apply? And then have your staff, your front desk or your office manager or your associate do that so they can take control over improving the statistics.
Great, great. And then now when you have employees and they have statistics, how does that help in motivating them to do more?
Yeah, I mean, they can get bonused, on, say you have somebody who helps with marketing and they can get bonused on new patients coming in and they can get bonused for hitting a certain production. So my front desk person, he's been with me about a year now, and he was like, okay, well, here's our finance stat. And then I was like, okay, well, that's you can know what your operation costs are. And Quentin, you helped me with this. What is the amount of money it takes to keep your office doors open, right?
Yeah,
And so some people call that BAM or, excuse my French, bare ass minimum.
sure.
And so I didn't know those numbers in the beginning years. I just kind of operated and paid the rent and tried to pay off credit cards, but I couldn't and I didn't understand why. And so knowing what it costs to run your practice, you know what your front desk needs to collect to operate. And so I had a front desk person and he told me, I was like, hey, this stat's down. What's going on? He's like, oh, well, Dr. Palmer, you make enough money. And I'm like, excuse me? And so we had the conversation of, okay, well, you either have a mortgage or a rent to pay. You have to pay the power bill. You have to pay this. And I went through some of the numbers, not all the numbers, because I didn't need to know everything. And I said, okay, well, where do you think the money comes from for me to pay your salary? And he's like, and he didn't understand. So I explained to him, hey, the money that we collect is what pays your salary. And so, yes, um, you think this is a certain amount of money, but no, this is where just to pay our bills is, and this is where you get paid as an employee. And he was like, oh, okay. And he had to change his viewpoint. And so, having that knowledge base, knowing what it costs to run your practice, what is the hard cost of your rent or your mortgage, of your electrical bills, of insurances that you pay, and so on, and that is your BAM, and you need to be making more than that to generate a profit.
Great, great. Okay, good. And then and then now as you implemented these things, I think you said you grew by about $1 million a year through COVID. Is that right?
Yeah.
And so you obviously you put in some right things into place. Um, uh, so with that foundation there, can you just give a feel for kind of, you operating as the captain of the ship, steering it and where you're going with that? And I mean, God, in the beginning of COVID, like nobody knew what the hell was going on with anything there. But you had a vision, you had a purpose, and you had a drive that went with that. Um, how did that really make that work in order to put you, as far ahead as what you got there?
So there's many answers to your question, so I'll give you guys the lowdown here. Our stats fell from a couple hundred, 600, 500, 600 patient visits a week, chiropractic, nutrition, and massage, down to 100. And I remember looking at my husband and saying, oh my gosh, if we're going to see 100 patients a week during COVID, then I don't need all these associates. I don't need all the staff. And we're gonna have to fire everyone. And my staff, a lot of them been with me over 10 years, and they're more like family than employees. And so I was like, that's not an option. And one of the things I learned at TBA is it takes massive promotion. So we started sending out postcards. We started turning up our social media. We started having these events when the rest of the world was closed. We had those patient parties, right? And did massive outflow, massive marketing. Like we turned it up because to me, firing my very loyal, awesome staff was not an option. The other thing that happened during that time was the implementation of a new system. And that new system was the quantum nutrition testing. And so I remember in 2020 talking to my accountant, and I was like, hey, like we're doing really, really well. Like, can I have a profit and loss? Like, where are we at? He's like, oh, I didn't bother doing any of them because everybody's failing. I'm like, oh, well, I'm not failing, so you should probably really look at my numbers. And he looked at him. He was like, holy crap, I thought you were failing. And I'm like, well, thanks for the vote of confidence, dude. And so that first year of the pandemic, we grew by 1 million. And then 2021, we also grew by 1 million. It was applying the principles in the business academy of you got to turn up your marketing, not turn down your marketing when things get funky. And then the implementation of a new system to be able to provide natural health care over the phone, which is the quantum nutrition testing.
Yeah, great. That's great. Well, good. Okay, cool. So I'm gonna open it up for questions. We've got quite a number of docs on here, and I want to make sure that that's in and certainly available to everybody here.
Sure.
I wanted to before that, Teresa, if you can put up a link in the chat so that you can schedule a consultation. I'd love to be able to get on and talk with people, and I think that Lisa would also make herself available. That if you don't want to open, ask your questions in an overall group setting here, that we can do that as well. But so we'll go ahead and put that up in the chat, but I wanted to open it up and see, are there any questions for Lisa with regard to what that looks like and, what we've gone over there, or any other questions there for me that we can go through here?
I would say I don't know if you want the questions in the chat or for them to raise their hand or whatever, but I would say guys that are on here, Quentin's offering you his time for free, and he is an expert in the chiropractic business space. And so even if you get on the call and you have no intention of being a client of theirs, I would at least, take him up on his offer and get into conversation. I mean, he is very generous with his tips too. Like you might be stuck in your practice, or you just feel like you're grinding, and you should be collecting more money in your practice. And the conversation with Quentin may be like the one thing that you needed to improve your office collections, or to take stress off of you in the front desk, or whatever you're running into. So it's free. You might as well take advantage of it. And then, of course, yes, if I can help in any way, please let me know. I'd be happy to help a fellow colleague. We are the solution in the natural health care. There's going to be more and more medical doctors that are pretend natural health care practitioners, because it's a cool thing or a popular thing now. And so now is the time for natural health care to get moving, to shine. And I want all y'all's practices to be as big as you want and serving as many people as you would like.
Great. Yeah. And, and thanks for that. Yes, I would absolutely love to help, each of you. And the more that we do that, the more that we, make healthy people. And like you said, Lisa, it's, now is the time. Now is the time. We finally got, the national, everything there nationally that's looking in that direction. We've got to
Natural
jump
health
on.
care is being more supported by the government now. Not that we need the government support, but like our society has, I think COVID really opened their eyes to what was happening in the medical profession, as long with Anthony Fauci and the masks and the shots and all that mess. And so now is the time to ramp it up, guys. And so it looks like Teresa put a link in there for you guys to schedule on the calendar, but I'm only going to be on here 15 more minutes, and then I got to run to my office for a meeting. But would love to, if you want to put nutrition in, do you have questions on that? What do you guys need help with? Can you tell me so thank you, Cynthia. Can you tell me if you include labs in your nutrition packages? I know you don't include the supplements, but let me know if you do any labs. Yeah, Cynthia, I don't include that in the packages. You absolutely could. We do offer a genetic testing. We could run labs through LabCorp. A lot of my patients arrive with lab testing. And then a lot of people we work on, their labs appear normal, but they're not normal. And so their medical doctor kind of writes them off and says, oh, well, it's just because you're going through the change, or because you're stressed, or because you're whatever. And so some of my practitioners I teach do functional medicine, and they do run a lot of labs, and some don't. So however you prefer to run your practice is up to you. One question I get a lot is, if you wanted to learn quantum nutrition testing, the best way to start is the QNT Academy. So QN as in nutrition, T academy.com. And for, I think it's like 99 bucks a month, you can start learning how to apply it. It's super easy. I realized that the training was really easy to learn when my daughter was 10 at the time. She started applying quantum nutrition testing to our dog. I was like, how do you know how to do that? And it was just from her hearing webinars and seeing stuff at the office. And so very easy to train, not this big complicated thing to learn, and is a beautiful adjunct to chiropractic. And so we'll actually attract nutrition patients and then sign them for chiropractic and massage. Or if we have chiropractic patients, then we'll also get them for nutrition.
Sure. Great. Yeah.
I do have one question about that, actually. So just so that I'm clear, do you have a different business structure? Like, do you put, let's say if somebody just wants to do nutrition, quantum nutrition with you in, let's say, a different state, you would put that under like maybe the coaching corporation rather than, okay, just so I know.
Yeah. So what state are you in?
I'm in California.
Oh, okay, yeah. So yes, if you're going to work with clients across state lines and you're only licensed in California, obviously you're not the doc in another state. So it's under health coaching. It's not, you can't do chiropractic in another state unless you are licensed in that state. So yes. And then health coaches, the good thing is that they have no licensure. The bad thing is they have no licensure. So if you have a front desk person who's super interested in nutrition, you can send them down to Florida or put them on the academy and start having them train as a quantum nutrition health coach.
Okay.
And then, of course, as you build things up, you can grow both sides of the business. You can grow the nutrition through the chiropractic. You can grow the chiropractic through the nutrition side of that. that's just having good systems in place and having, you know, ways to go about, you know, doing that for sure.
Yeah.
Well, great. Any other questions there, Aaron, Shanuri, Crystal?
I think
Um,
Shanuri was raising his hand.
Oh, go ahead. You have to unmute yourself there.
I don't think I was.
Oh,
No,
well, I just wanted to talk to you then.
okay, okay. I mean,
Where's your practice?
I'm in Memphis. I'm in
Okay,
Memphis.
nice.
I'm an exercise science major as well. Kinesiology. You just put some ideas on my mind. Strong. So I
Thanks.
really appreciate you for sharing.
You're very welcome.
Great.
Is there anything we can help you with?
I would say right now I'm kind of marketing, maybe I'm kind of trying to reinvent myself on the fly. To be honest, I've been doing basically a lot of personal injury over the years, and I'm trying to now just add. I've had 3 to 4 clinics throughout the state of Tennessee, and in 2020 I closed 2 of them down, and I'm with the one here in Memphis. It's just for the numbers as far as personal injury, I'm not able to get back to the numbers that I need to be where I want to be. So I want to implement. I'm not 100, whether it's health, whether it's cash, whether it's nutrition. I'm trying to figure out what I'm trying to implement to make up the difference.
So, you know, the first thing that I would say there is, I think you know, the personal injury practice is a great thing to be in, and obviously people need that help. There are pluses and minuses to a personal injury practice. You know, in a personal injury practice, you get paid better typically than what the health insurance pays you for. But you're also waiting for the money for quite some time, and you're dealing with a patient base that, because they're not paying that money out of pocket, there can be a little less of the patient's own
Lights.
drive to get better,
Yes, okay.
right? Now, with that base in, and I wouldn't throw out what has made your practice successful so far, but with that base in of what you have right now, you want to add to that. And you want to add things to that that are going to help you to get to the next level there. The great thing about nutrition and a cash practice is that you can market that to wherever, and then you can set your own fees. You can work out what those things are. You know, the world is your oyster as you go about doing that. Now, you're going to have to overcome the rejection that you fear might be there by people saying no to you or not paying you or different things like that. And these are all things that we teach. So if that's what you're looking for, that's where you'd like to go with that. Hey, let's you know, let's sit down and have a conversation, and we can go through that and help you to go in the direction you want to go with that.
Okay. Well, I scheduled an appointment. I'll talk to you tomorrow at 9:30.
Perfect.
Look at that, Doc, taking action. And by the way, congratulations on 3 practices. Like, that's very well done. You know, I mean, to be able to run 3 practices, you absolutely have some things in place, and then of course down to 1 after the pandemic, totally doable, but you already did 3, you know. And so I think you meeting with Quentin, he'll help to see what other opportunities are there for you. And then with your ESS, your exercise sports science bachelor's, you absolutely could add in something like nutrition, so you're not just, everything's not just focused on PIP.
Right. I mean, I'm 100% with you. I'm just ready. I really am. That's why I reached out. So I'm 100% full action. I'm ready to go.
Well, you know what? You're most of the way there already.
I appreciate it.
Yeah. Great.
Cynthia's asking Quentin, how do you figure out if it is a $2,000 versus $4,000 package? We do a lot of inflammation hunting, and some cases are straightforward and some aren't. So Cynthia, for us, my husband and I, so I'm completely out of patient care. My husband's show, Brave TV, is very takes a lot of time and is doing very well. It's over $1 million business there. And so we're the doc prices are at 4,000 and the associate prices are at 2,000. And we do that on purpose so we can push people over to the associates. So that's why there's differentiation between the two different schedules.
Do you typically, I guess with her question there, do you typically have like a length of time, and most people are just kind of doing that same length of time, which kind of gives them what that looks like, and then they'll sign up again afterwards for
Yeah,
for
so
that?
the initial program is 3 months. Typically it's on the phone 10-minute visits. And so there's specific things we're doing during those visits. And then if the case is really complicated, Cynthia, like it sounds like you run into some of those as well, is that we'll do another 3-month membership. If they can graduate to the next phase of care, then we'll do a package of 12. But with the intent of always helping them get to their next level of health.
Great. Great. All right.
Quick,
And
quick.
go ahead.
When you say you sell the chiropractic packages of 12, um, is that for? Are you saying 12 visits, 3 months, or you just saying the 12 visits?
Well, we do chiropractic. We haven't done, it's funny you mentioned that because we are looking at a program where you can kind of get VIP, where you get chiropractic, massage, and nutrition under a membership, but we haven't sorted that out. So right now our nutrition program is a 3-month membership, and we sell chiropractic at a 12-visit package, and they get a discount for purchasing the 12 visits up front.
Okay. I'm in the process of kind of trying that exact. I just haven't kind of figured out, like, just say for instance, $75 an adjustment. My thing is, you need it twice a week,
Yeah.
so that's 150.
So you'd be 6 weeks, for 12.
Yeah, so $75 an adjustment, 12 weeks, $900. You'd usually give them somewhat of a discount, maybe if they if they paid up front for that. Now, 12 visits, some chiropractors are doing 24 and some are doing 36 visits depending on where you're at. And you're right that in an acute care, that's what that's going to be. What we see is that on the other hand, if you don't get that patient to commit to that care, they typically will come to see you somewhere between 3 and 5 visits. They'll get out of pain and you won't see them anymore. And at that point, I would say that rather than truly being a chiropractor and correcting the structural issues, you are becoming an expensive Advil for that patient.
Okay.
So what we do is we teach you how to educate the patient, and really how to, the more that you educate that patient and the more that you bring, you've got a reality level that's up here and they've got a reality level that's down here. And they're not ready to commit to that because you have not brought their reality up to where your reality is at. And once you can teach them, and we actually teach that patient at an 8th grade level, once you can ask the right questions and bring them up there, now they understand that what's going on with them has been going on with them a lot longer than 2 days ago when their back started to hurt, and that it's going to take more care in order to do that. That's the education. You're a doctor, so you're a teacher. And so now you're going about putting that in place, and now you'll get that patient onto care, and now you can sign them up for as much care as what they need. And like Dr. Lisa said, your front desk is going to be so much happier with not having to collect the money every single time they come in, schedule a new visit every single time they come in. You're limiting the size of your practice by doing that. You've just got to spend the time up front to educate and to get those commitments going, and now you can get to where you want to go with that.
Gotcha. Oh, okay. I'm done. I'll see you in the morning.
Great. Great. Okay, perfect. All right. Well, a couple more minutes. Crystal, Amber, Mari, Brian, John, any other questions there? Heather, Barbara, Kevin. Look at that. Bill Perks is on here.
Hey, Bill.
Okay, great. All right.
So
And
Cynthia asked another question here on
okay.
marketing. Yeah. So the question, Cynthia, you're asking is, since you have so many streams of income and services that are great, how do you manage to market it all? Yeah.
Like,
So
where do you
I do.
find the priorities? Like, how do you, like, what's the rhythm to that? Like, where's your pulse at? Like, how do you know,
Yeah,
like, yeah.
how you're so scattered and so many cool things to offer. Yeah,
Yeah.
absolutely. So you can check out my Facebook page. It's Palmer Natural Health, and you'll have an idea of how we're doing that. But Doc, I would focus on what's your favorite patient, right? Like, is it the mom with kids that's exhausted? Is it the menopausal female? Is it like, if I were to ask you that question, who is your favorite type of patient?
I mean, I see the problem is I find uniquely with chiropractic and doing functional medicine, it's really hard to like, yes, of course, I love seeing pregnant moms. I have my fellowship in pediatrics and prenatal, but then I'm talking about fourth trimester nutrition. So we end up doing, some functional medicine with them to help them out with that. So like you see people come in the gateway of chiro, you see the people come in just for a functional medicine, and you see them both. I just sometimes though it's just like a big orchestra. And so I'm trying to make it clearer now for myself. Did you start having separate hours for those nutrition patients? Like, how did you deal with the demand and organize yourself so that you can be successful and continue to scale and then also train those other people that you're onboarding?
Yeah, I mean, Doc, I wish I had you when I was pregnant because I needed you very badly. My husband's a chiro and he took where you can massage the ligaments, Webster technique. He did
Yeah.
Webster, but I wish I had you just because of your knowledge base. And so if that is who you love working on, I would, get along, find the midwives in your area and the birthing centers in your area. And I'm sure you're already doing that because that's your wheelhouse. I don't have all the data you have as far as working with pregnant moms, right? My first degree was in sports medicine. So the beginning of my career was all sports chiropractic and I was a sideline doc. And so really focusing on that message, because wouldn't it be fun having these pregnant mommies coming in and all you're working on is pregnant mommies? And so with that, to answer your question with nutrition is I had chiropractic hours and then Tuesdays and Thursday mornings, I wasn't doing chiropractic. And so when I first started implementing nutrition to the practice, I would do nutrition patient appointments on Tuesdays and Thursday mornings. What ended up happening is I didn't have enough space for them on Tuesdays and Thursday mornings. So it leaked into the other areas, which was fine. So a new patient nutrition or a new patient chiro is the same amount of time in our office as a 30-minute slot. And we would schedule an exam and we would differentiate by color. This is a nutrition exam or this is a chiropractic exam. And then follow-up visits were 10 minutes, whether they were chiro or nutrition.
Okay. And then you just let your associate doctors take the chiro and you did more nutrition, I'm assuming?
No, actually it was easier to find associates for nutrition. So I started pushing some of the nutrition to them. And
Okay.
then my husband decided to go to chiropractic school after seeing all the cool chiropractic miracles. And so then I started pushing chiropractic to him.
Okay. Thank you.
Yeah, you're very welcome.
Great. All right. So we're gonna end it off here pretty shortly now. Teresa has put in the chat there. You can go ahead and schedule an appointment. So Shanuri, that's great. We'll definitely talk in the morning. Crystal, Bill, Amber, Mari, Brian, John, and anybody, go ahead and set that up. I'd love to talk to somebody right now. If you got the time, we can jump into a breakout room and we can certainly help you with that. Other than that, thank you very much for attending today. And we'll talk soon.
Bye, everyone.
Goodbye.